This week, the U.S. confirmed its first bird flu death, and though the risk to humans still remains low, it's a major cause of concern among public health experts. WMER 2 News' Blair Sable spoke to a virologist at Johns Hopkins University who explains why.
On Monday, Louisiana health officials announced the H5N1 virus claimed its first human life in the United States. The unnamed patient was 65 years old with underlying medical conditions who had been exposed to a backyard flock and wild birds. More than 1,200 miles away, virologist and professor at the Johns Hopkins School of Public Health Andrew Pekosz is keeping a close eye on the case, not because of the seriousness of the infection, but rather what testing revealed.
They found some interesting mutations that would suggest that the virus was starting to adapt to be better at infecting humans. That was just the start of a signature, but it really represents one of the things that we're really worried about.
First detected in humans nearly 3 decades ago, 65 people have been infected with bird flu during this latest outbreak.
We're in the midst of about a 2-year cycle where there's been an incredible explosion of H5N1 infections in migratory birds, the natural host of the virus, as well as spillover into other animals.
That being foxes, bears, and dairy cows. Raw milk, which has gained popularity recently, has been linked to the infection and death of pets. Right now, the risk to the public remains low, and Pekosz says we are better prepared for a potential H5N1 outbreak than we were for COVID's 5 years ago. But similar to the onset of the pandemic, he believes more testing needs to be done, not only to monitor how widespread it is, but if there is ever human-to-human transmission of the virus, which has not been detected so far.
We know that H5N1 can cause very severe infections. What we're really trying to figure out now is what percentage of infections result in that severe infection. Is it 1%? Is it 10%? Or is it someplace in between, perhaps?
The best way to avoid getting sick is to avoid direct contact with wild birds and poultry or any objects that may be contaminated with their saliva or excrement, as well as to avoid eating raw meat and milk, which may have higher concentrations of the virus. Blair Sable, WMAR 2 News.